Well, robotic was first introduced to the world in year 2000, and it is actually the first robotic system, Da Vinci, that was approved by the FDA. Now, it's been widely employed by different disciplines, for example, gynecologist, urologist, general surgeon, ENT surgeon, as well as the other discipline. Shorter hospital stay, less pain, early recovery, less risk of infection, less risk for bleeding, and of course, lesser chance of blood transfusion. For example, in a prostate cancer surgery, the patient go back literally the next day. Now, compared to those days when we do the prostate cancer surgery, the patient probably will be warded for a couple of weeks. And of course, there are risks of infection because of a big incision there. Now, also more complication when it comes to operating on a very narrow field. It actually does take a little bit of time for us to position the patient, docking the robot. But the surgery itself is just the same as a normal open or even laparoscopic surgery, ultimately down to the skillfulness of the surgeon in terms of handling the robot as well as the skill of handling the surgery. In fact, all the operation that we do intra-abdominally can be done robotically. So those days, if you were to look at the open surgery, basically you can actually operate on literally any organ in the body. But when it comes to a very narrow field, for example in the pelvis, we actually have a problem because we could hardly identify the organ down there. And when it comes to heavy bleeding, when the patient bleeds quite a bit, it's almost like blur out the whole vision that you cannot see anything at all. It is actually a machine that allows the surgeon to see the operating field very, very clearly. It has up to about 10 times magnification in a 3D vision. Then you can almost see the bleeder immediately and catch hold of the bleeder so that it doesn't bleed torrentiously. And it replicates the skillful movements of the surgeon. And it's almost like putting our head and also the hand inside the patient's abdomen. So we don't actually have to feel the organ, but we can actually do the surgery as if we are feeling the organ. It actually does take a little bit of time for us to position the patient, docking the robot. But the surgery itself is just the same as a normal open or even laparoscopic surgery, ultimately down to the skillfulness of the surgeon in terms of handling the robot as well as the skill of handling the surgery. So you got to learn step by step. So it is actually painstaking and tedious. You need to know the machine well. You need to know how to troubleshoot, because you do not want the machine to go malfunction halfway with the robotic arm inside the patient's abdomen, and that would be a risk to the patient. So, for example, if a person were to use the robot to operate in Mexico, and a surgeon in US and UK can actually kind of like assist and give the advice to him regarding the surgery, without you having to be present in the operating theatre in that country. About 85% of the prostate cancer surgery in US are done robotically. 75% of prostate cancer surgeries in UK are done robotically. And you know that up to this time, about 5,000 over robotic systems are already there all over the world. So it is the future.